Yeah, so the first question is what tips do you have for better sleep? And that's a very broad question, and if you have a couple more hours we could probably go through all of them. But in general, there's a number of issues that have to be addressed. If there's insomnia, if there's non-refreshing, non-restorative sleep, if there's restless legs, and there's specific treatments for each of those things. But again, you know, we start off with the non-pharmacological therapies such as good sleep hygiene. You want to have a regular sleep time. I'm always impressed when I have patients fill out what's called a sleep log, that their sleep and wake time is usually all over the place. And you don't have to be extremely strict about it, but in general you want to be able to go to sleep about the same time, and you also want to wake up, you know, around the same time. And keeping a good rhythm, sleep-wake rhythm like that can be very important. Having a very uncluttered sleep space is also going to be helpful. A lot of patients, partly because they're in pain and they have difficulty sleeping, end up doing a lot of things in their bedroom, watching TV, on the computer, and these are all things that actually interfere with insomnia and stimulate the brain and make it more difficult for patients to sleep. So we will have patients remove the TV and the computer from their bedroom and stress the fact that the bedroom is only the place to do bedroom activities such as sleep. So it's important to keep your bedroom as a sleep sanctuary and remove anything that doesn't involve sleep from that area. And if medications are required for sleep, then, and in the vast majority of fibromyalgia patients that's something that we end up doing, then we need to be logical and make sure that those medicines aren't too short or too long or have side effects that may interfere with other complaints. I'm going to move on to the second question, which is there such a thing as oversleeping? That's an interesting question. There was a study that came out a couple of years ago that showed that patients who sleep less than 5 hours a day or patients who sleep greater than 9 hours a day have a slightly higher chance of dying earlier. We're not entirely sure what this means, and that study has not been reproduced. So it's going to be hard to comment on that. However, a very common phenomenon when you oversleep is called sleep drunkenness. And what happens is the mind can't quite adjust to the new time zone that you're waking up in. In a way, it's a type of jet lag. We have hormonal rhythms in our body, and some of them are called circadian rhythms, which regulate with the day and night. You're supposed to make cortisol in the morning, and you're supposed to make melatonin at night. And when you oversleep, you sort of miss your cortisol, and you end up feeling like you're not sure if you should be awake at that time. It can affect your cognitive functioning. So yes, I know a lot of people with fibromyalgia like to try and catch up on their sleep by sleeping in late, but it ends up a lot of times creating more problems than it solves. I'm going to go and talk, speak this next, let me see, this next question here about that the pain. This patient complains that at night when they go to bed, they're nearly pain-free, but during the night the pain becomes more intense, including the hips, and by early morning they cannot stay in bed any longer and have to get up and move. And trying pain relievers such as Aleve or ibuprofen, which are over-the-counter anti-inflammatories, don't seem to make a lot of difference. And this is actually a common problem. The first thing is things like Aleve and ibuprofen are anti-inflammatories, and there's never been good evidence that they are successful in fibromyalgia. And we understand now that fibromyalgia is a central nervous system pain problem. In other words, the pain is not on the tissue level, it's not in the joints, even though we perceive it to be. It's not coming from the muscles or the bones or the joints. The pain is being generated within the nervous system itself, sort of like an amplifier amplifying the sound that comes out of a CD player. It's not the CD player, but the amplifier that's the problem. Consequently, the medicines that we use to treat pain are not anti-inflammatories. They're drugs that work within the central nervous system. Lyrica is an anti-seizure drug. Savella and Cymbalta were previously referred to as antidepressants, but they all affect the way the nervous system modulates the pain response. And the reason why patients tend to have more pain at night is a very, very common phenomenon that we see in other conditions as well, and that's because during the day our attention is really focused outwards into the environment, but at night our bodily attention focuses inward. So a lot of people with a lot of pain issues will have a lot more pain at night because of this reason. Usually we'll medicate people with agents like Lyrica, which can sometimes make people sleepy. The older versions of these drugs, gabapentin, Neurontin as well, and they can actually be very successful. We use them in high dosages at night, not only for pain relief, but sleep as well. The next question is about pillows, and if I recommend a particular type of pillow. This person states that muscles and nerve pain is very localized around the shoulder, neck, and mid-back area, and very stiff every morning upon awakening. And this is a very common complaint in people with fibromyalgia. As a matter of fact, this is how we diagnose fibromyalgia. Patients do have to have shoulder, neck, and mid-back and spine pain to even be considered for the diagnosis. And stiffness, as we saw in that first slide that we talked about from Dr. Bennett, is actually the most common complaint in patients with fibromyalgia. The pain is, again, usually treated with pain agents such as Lyrica or Neurontin. I found sodium oxybate to be very, very successful. It helps with sleep and pain. And the stiffness also tends to be relieved if you can improve your deep sleep. And right now, the only experimental medication we have that's shown any benefit in this area is sodium oxybate, unfortunately. I do not get a lot of response from other medications in this area. There has been some look at using growth hormone itself, and that can be very expensive. It's an injection. But both of these do the same thing, and they facilitate deep sleep. And I think that that's really the key to avoiding that early morning awakening. The next question is about how can I tell if I'm getting truly restful sleep. And you know, this is something that's hard to quantitate. Typically, when we do sleep studies, we're looking at things like if you have obstructive sleep apnea, if you have periodic leg movements, if you're getting a lot of sleep. But the quality of sleep, which is what this question is really getting to, is something that has been somewhat difficult to pin down. However, I do believe that the alpha intrusion phenomenon, which is the intrusion of those wake-like brain frequencies into deep sleep, is very, very telling, and it's very common in people with fibromyalgia who have non-restorative sleep. And this is, again, something that we can now measure using the experimental quantitative EEG strategies that we've talked about. And I find that when we study patients before and after therapies, if there's an improvement in that alpha-delta phenomenon, that does correlate with an improvement in their refreshing restorative sleep and a decrease in their fatigue. And lastly, there's a question here, exercise, what's most effective and helpful? This is a bit of a double-edged sword because people with fibromyalgia are in a lot of pain and they don't really feel like exercising. But at the same time, if people don't exercise over the long run, this is bad for our health in general. So we have to kind of find a balance to exercise as much as we can without exacerbating the symptoms beyond what we can tolerate. There have been a number of studies, and I didn't include this particular slide from the EULAR, the European League Against Rheumatism recommendations, but they've found that some physical therapy and exercise can be helpful, but in particular there have been a number of studies that have looked at aquatic therapy, that's using pools, and aquatic therapy seems to be uniquely effective in people with fibromyalgia, probably because it's low impact, so there's not a lot of stress on the joints, it's very aerobic, and there seems to be a neuromodulatory effect with reducing pain by submerging your body in a different environment. And so I would say the most effective and helpful therapy is probably aquatic therapy. And it seems to be, let me see, if we come to the end of our questions, it looks like that.
Yes, thank you very much, Dr. Rosenfeld. I learned a lot. I'm sure that the people who are with us did also. I sincerely appreciate the information and the time that you spent with us this evening.
Thank you so much.